Hello, this is Jada and Emlyn with our first episode of Stories Behind the Scrubs. On this podcast, we interview medical professionals in order to get a better idea of what it is they do and why they do it. We also listen as they tell us their story, recounting how they chose to go into medicine. On today's episode of Stories Behind the Scrubs, we're going to be talking to Antepartum nurse Cathie Lee. Cathie Lee attended DeBakey, a medical high school in Houston, before deciding to go to college and become a nurse. Shortly after graduating from nursing school, she began work as an antepartum nurse and has now been working in the Houston Medical Center for about a year. Okay, so I guess we'll just kind of start in high school since that's where we are right now. You went to DeBakey High School, right?
Yes.
So that's like the medical school. Can you tell us a little bit more about that?
Yeah. So DeBakey High School, it was created by Michael E. DeBakey, the famous heart surgeon. So he made a high school specifically for medical professions, for students who are interested in the medical field. So the first year of like your freshman year of high school, they kind of go into like different classes that introduce you to different types of medical professions and medical terminology. So they have like introduction classes to like dental, or if you want to do like a lab technician or nursing, and into med school as well.
When you originally enrolled at DeBakey, did you already know that you were interested in going into the medical field?
So I actually did it, in middle school. I didn't really know what I wanted to do in college. I wasn't thinking that far into the future, but my mom highly suggested me to go to that school. And, just to appease her, I decided to go. But after like my first or second year of high school, I actually became more interested in medicine. So I thank my mom for that because if it wasn't for that, I wouldn't have known what I would want to do in college.
Yeah. So you said you became interested kind of in like your second year. Did you know like kind of exactly where you wanted to go? Like, did you know you wanted to be a nurse?
I actually didn't. I was geared towards medical school. I knew medicine, but I think I was just naive and I didn't know exactly what I wanted to do, but I wanted to do, something in medicine. I actually didn't want to go into nursing until I would say college when I became more knowledgeable about, the nursing field.
Wow. So in high school, your plan was kind of so you were going to go to college, a 4-year school, and then you were kind of thinking medicine, but you weren't sure. So where did you end up going to undergrad?
So I went to UTSA, so University of Texas at San Antonio. I did my undergrad there, and maybe like around freshman year is when I started. I went looking into different like extracurricular groups. So I did go into like a medical group and a nursing group. And I think once I started like focusing on the nursing program, I started becoming more interested in the nursing field around like my second year of undergrad.
And then so transitioning from like high school life to college life, I mean, what do you think was the biggest difference for you?
So as I reflect back with going to DeBakey is it's a really difficult school. They tried to prepare you for college. So a lot of the classes are like pre-AP or AP courses. So I think in my opinion, DeBakey was a lot more difficult than in college.
Really?
So yeah, by the time I went to college, I felt like I was really prepared. And some of the courses were a lot easier compared to DeBakey because DeBakey is very, very strict on their studies, as
Oh,
I should
wow.
say. So that was the big difference. I felt like I was a lot more prepared, for college because of DeBakey and the courses there.
Yeah.
And when you had initially gone into college, Jada had said, you had decided on going to a 4-year school. At that time, what was your plan?
So at that time, so I'm not sure if you guys are familiar with the nursing prerequisites to get into nursing school, but you only need 2 years of prerequisites to get into nursing school, and then once you start applying to nursing school, the nursing program is another 2 years, so it's a total of 4 years. So my original plan, since I was undecided with my degree, I was just gonna go to 4 years undergrad and try to get like a medic or try to get into medical school but I actually ended up changing my mind to do 2 years of undergrad and then 2 years at nursing school.
That's really interesting.
So, so you ended up only doing 2 years of undergrad and then you applied to nursing school?
Yeah, so I was a little bit, it took me a little while to figure out that I wanted to do nursing.
Mhm.
So I did about 2 to almost 3 years of like undergraduate classes. And then I decided I actually want to apply for nursing school. So it took me about 2 to 3 years, and then I eventually applied to nursing school so I can get into the 2 year program. And I applied for nursing school all over Houston, and I actually got into University of Texas Medical Branch, so UTMB in Galveston. So that's where I completed my nursing degree, and I got my bachelor's degree.
Okay. Um, so going back a little bit, so you're still in college at this time, right? And so, I mean, what was your course load like? I mean, obviously compared to DeBakey, it was a bit similar, like the courses were
Yeah.
still, but I mean, can you kind of describe what that was like?
So I did actually do a full course load of classes. So in college terms, a full course load is 12 hours of classes. So that's equivalent to about 4 classes per semester. So I was going to school full time as well. I was actually working part time as a pharmacy technician too for Walgreens.
So why did you decide to work as a pharmacy technician? Like, what did that entail, and why did you go that direction?
So actually, it was also my mom's influence. So, technically you do have to be 18 years old, to work in the pharmacy. So she just suggested it just to, I guess, open my eyes and broaden my ideas for, if I could be interested in pharmacy. So it was an eye opener, because I did not like being a pharmacy tech. It's a great job, and I do really like appreciate it for my knowledge of medicine and how it helped me in nursing school. But it made me realize that pharmacy, like the pharmacy track was not my track, but it could be for somebody else. So, my mom suggested that job for me because it's a good job, to help me be more familiar with medications and, my interest in medicine. And it was a good job for, someone who's in college. So
Yeah.
that's how I became a pharmacy technician. And I did that for my whole, college career. Even in nursing school too, I was a pharmacy technician too
Oh,
for a
wow.
little bit. Yeah.
Would you say that gave you an advantage? Your mom had said that, it would be good to familiarize yourself, but did you find that it helped you?
Yes, for sure. Because in nursing school, there is a pharmacology class, and a lot of my classmates were just becoming just familiar with like medication names and the uses, and we have to learn like side effects of medication. So definitely being a pharmacy technician put me like at a way bigger advantage compared to my classmates. So definitely it's a good job if you want, to see different like parts of the medical field.
So you were working, you were going to college, then nursing school. What was it like your work and school balance, or like your free time? What did you do?
So in San Antonio, it's a lot more different than Houston. Like they
Mhm.
have more like hiking trails and things like that nature. So on my free time, I did enjoy like cooking and taking my dog out on hiking trails. It was a lot more outdoorsy things. And of course, like usual things like watching Netflix and going to movies, stuff like that.
Yeah.
But yeah, I noticed for me personally, because I did work, it was a little bit harder for me to have more free time compared to my other classmates, I
Right.
would say. Yeah.
And then just kind of like on the med school, nursing school, like what do you think is the most important thing that they incorporated in nursing school that helps you the most?
Let me think about that one. Like as in that would help me like in my nursing career now, or
Yeah, like as a nurse now, looking back, what were some of the classes or like things that they discussed that really helped you like be successful?
okay, so one of the basic classes that you take in nursing school is called pathophysiology, and it's one of the first classes that you take in your first semester of nursing school. That class, it basically goes into details of different like disease processes and what the treatment plan is, what medications you need to take, and what to watch out for. So I would say that class in particular helped me become, a really good nurse because helped me become more familiar with the most basic disease processes. Um, and I would say in my undergrad career, definitely anatomy and physiology was the class that definitely, it helps you with your foundation for nursing school. And I would advise students, if you're really interested in anatomy and physiology, then it's a good framework for if you decide to go into medicine of nursing school or, medical school.
You had said earlier that it was around after 2 to 3 years of undergrad course load is when you decided to switch from medical school to pursuing nursing.
Mhm.
What kind of influences helped you make that decision?
One of the major things, and I'm going to be honest, is I know medicine, like medical school, is very long compared to nursing school. Nursing school, like I said earlier, it's a 2-year process. I respect doctors and, if you have the dedication to do that. But I think me personally, I wanted, to start working a lot quicker. And, I did more research into nursing compared to being, a doctor. And I think, in my opinion, and I see it now when I work, as a nurse, you're there at the bedside, with your patient, you're getting to know their story and you're there basically 24/7 with the patient. With doctors, they're very, very busy trying to handle um, multiple patients at once. So they only have maybe a minute to interact with their patient. So I, I wanted to go into nursing because I know it, like the process to get there to start working was a lot shorter than, medical school, but also just the different roles that we have compared to being a doctor.
Yeah, I had never thought about the degree of patient interaction before, but that's really good that you're able to get to know the patients.
Yeah, and I think that's what I really love about nursing is I get to see these patients like on their ups and downs. I'm basically as a nurse, you're there to assess your patient and notify the doctor of any significant changes. So you're basically the eyes and ears of the doctor. So that's how we work together.
So you're spending a lot of time with your patients. I mean, how many do you usually have?
So on an average basis, I usually have 3 to 4 patients at a time. But so currently I am a antepartum nurse, which means I help pregnant patients before they deliver. So I don't labor patients. I don't deliver, babies. So I'm there for patients who aren't quite ready to deliver yet because they are considered preterm or they're not ready. The baby's not full term. So on average, I have about 3 to 4 patients, but I'm also responsible for the babies too. And, sometimes moms have multiple babies like twins or
Yeah.
triplets. So I'm responsible for the babies too in the belly.
Yeah. Yeah, so it looks like one person, but I mean, it's a lot you have to take
Yes.
care of. Yeah.
Yeah.
So you decided to become a nurse after like kind of throwing away the medical school idea. Um, but how did you decide you wanted to be an antepartum nurse?
So your last semester of nursing school, they have what is called capstone. So it's a clinical rotation that you get assigned to. And you're basically shadowing a nurse's schedule almost full time because you're basically done with your classes. So this is more of like, it's almost like an internship for nursing school. So I actually got assigned to the antepartum unit. And unfortunately, I also got night shift too. So I had to coordinate doing night shift rotations and then going back to school on days. And so I actually followed a nurse who is my fellow coworker now because I actually got hired to the same unit that I had my rotations in. But basically, I followed an antepartum nurse for my nursing rotations, and ever since then, it made me realize like I really enjoyed doing this job.
So what are kind of like the job differences between like an antepartum nurse and say like other nurses?
So antepartum nurse, like I said earlier, we're basically there to help pregnant moms who aren't ready to deliver yet. So I get a lot of like really like high risk moms. So I see a lot of like high blood pressure patients, patients with diabetes. Um, they sometimes they have like preterm labor, so they start contracting before they're ready to deliver. So it could be basically a full-term pregnant mom is 37 weeks. So I see any patients ranging from, I would say, 20 weeks to up to 36 weeks. But I basically our goal on the antepartum unit is to make sure our patient is pregnant, and we don't want them to deliver early because in the end, if they do deliver early, that means the baby will end up in the NICU, so the neonatal ICU.
So kind of going back to like the nursing school, so you said that you were working and you would go out like hiking and stuff when you were free, but how did you manage like your time management?
So time management, like I'm going to be honest, it was a little bit difficult because I was juggling more than your average college student. I was working on top of trying to go to school. It's a small percentage of people who actually I would say 50%, of people go to college, just strictly college, and then the other half they do work like I did. Honestly, it's just you have to manage your time really well. And I only worked part-time, so that did help a lot with, trying to manage both. But I also had, friends that I made sure that I would see. And I basically, it was a little bit hard to manage my time. But if you're strict with it, I think you can do it.
So, while you were in nursing school, I'm sure, uh, there was a lot of preparation being done for the NCLEX. What was your
Mhm.
experience with that exam overall?
So So we call it the NCLEX, and the NCLEX was the hardest test, and you can talk to any nurse about that. It is the hardest test you're gonna take in your nursing career. It gave me the most like anxiety I've ever had, and I'm not an anxious person. So basically, the NCLEX, there's a minimum of 75 questions that you need to pass, but it is a computer-based test that basically it either adds, so it can add how many questions that the computer thinks it needs for you to pass. So there's a specific bar that you need to answer this amount of questions. But if the computer system doesn't think that you're doing well, it'll keep adding questions until it thinks that you're competent. So it's not a set question. It could either be a minimum of 70 questions, and I think the maximum is like 200. It's a crazy number. So luckily for me, I think my passing point, I think I passed at 82 questions. So I didn't have to go too far. But people don't know if they're going to, like, if the test is going to end or not. They just keep going and going until it ends. So that's why I say it, it's that test gave me so much anxiety, and I'm not even an anxious person.
Yeah, so how did you study?
So a lot of me and my classmates, we used this website. It's called U World. So U as in like the letter U and then world. And it's basically a website that you have to pay they give you practice questions. And it's really cool because they have the website uses the same format as the NCLEX. So when I went in to go take the NCLEX, it's kind of like I was taking the same questions. But basically, and they give you rationale of why that answer is correct or wasn't correct. And basically, I would take those practices every day. I would try to do 75 questions every day to mimic like the NCLEX, and I would write down rationale if I missed that question. So that's what I used for UWorld to pass the NCLEX.
And is preparation for the NCLEX done during nursing school or is it after?
I would say it's a little bit of both. Nursing school, they try to, educate you on they try to educate on all the topics. But I would say I was able to practice a lot after nursing school because during nursing school, I was so focused on trying to pass tests. And so I would say it's like 50%, you know, they taught us in nursing school, and I would say 50% after I graduated and studied with UWorld.
We had talked about which class in nursing school and undergrad you felt had best prepared you for your career. But on a different note, which class would you say was your favorite? Like you looked forward to it the most and you really enjoyed the content?
I would say anatomy and physiology. And I think that's why I tell a lot of people who are interested in nursing, if you take that class and it really does interest you, I think it'd be, really good. It would probably, you would be interested in anything in medicine, because it's basically you learn about the body and how the body works together. So I think A&P, it was my favorite class for sure.
And then you were talking about how you were studying between like towards like the end of nursing school and then before you like got and like you got your job. So like was there a big break between then, or like what was that like?
Like the break between me graduating and getting
Yeah.
hired,
Hmm.
I would say it was about a month apart, because in nursing school, your last semester of nursing school, they also prepare you to start applying for jobs.
Okay.
And there's only like a certain amount of open during different seasons of the year that hospitals will hire. So I graduated in the summer, and I would say after a month after I graduated, I actually started working. So I actually applied for my job, like I would say the beginning of my last semester of nursing school. So everything kind of went pretty quick.
Yeah. And
Hmm.
so like so everything went really quick. You were about a month out and then you got your job. I mean, what was like really different from school and then your career?
So I would say with school, they basically teach you the basics of what you need to learn with each department. And then when I started working as an antepartum nurse, you're more focused. So I'm more focused on like obstetrics nursing, so OB nursing for pregnant patients. So I would say when you do get hired, you learn to become more focused on your skills depending on what unit you work on. Compared to with nursing school, they just teach you the broad general idea of each unit that you need to learn.
So your favorite part of your job is probably like connecting with all of your patients, right? Um, but I mean, what else like do you really enjoy kind of about going into work and just being in that environment?
So since my job, we do have like long-term patients. So a lot of like patients who come during like their earlier stages of pregnancy, sometimes, they stay their entire pregnancy until their baby is full term. So obviously connecting with my patients, I love that part of my job. But also, there are some times when we do get really sick patients, and I really enjoy like when I've put in like a lot of work and time with this patient, and the end goal is for them to deliver a full-term baby. So I would definitely say I love seeing that, my hard work with taking care of this patient has, gone through, because then they actually get to deliver their baby and the baby's healthy. They don't have to stay in the NICU. So I think that's one of my favorite parts of the.
And then you said earlier that you're working sometimes with like these high risk patients. I mean, what is it like? What was it like the first time that, something like a case didn't really go the way that you guys wanted it to?
So usually, if there's only so much you can do with pregnant patients. Sometimes with all the medicine that you can give them and all the interventions that you do, sometimes these patients are really sick, and unfortunately the only end goal, or like the end result, is to send these patients to labor and delivery. And some of these disease processes, no matter what you do, the only thing that you can do to help this mom or this baby is to deliver them, which is kind of crazy, because sometimes just pregnancies can be so, can be very hard on a mom's body, and the only way to resolve it is to deliver the patient. So things can turn, south really quickly if you don't fast, I would say.
What are some of like the most common cases that you guys get?
So basically, like I said earlier, some common is there's high blood pressure, patient. So it's called preeclampsia or eclampsia. So preeclampsia is a disease where patients have high blood pressures, and it can affect like their the protein in their body. And then there's eclampsia, which is same thing as preeclampsia, only eclampsia has seizures in it. So ideally, we want a patient to we don't want them to go to eclampsia because that would be bad for mom and baby. So we like to manage their blood pressures before they get, to a case like that. We have patients with gestational diabetes. So that is basically a mom who she wasn't diabetic beforehand, but during the pregnancy she became diabetic. So we have gestational diabetes. We have patients who come in for preterm labor. So either they start contracting and they're not quite ready for it to deliver, or I'm not sure if y'all are familiar with the cervix in the OB world. So the cervix is basically what holds, it prevents, the cervix is what holds the pregnancy. So if the cervix starts shortening, then the mom could deliver early. So sometimes there's moms who have short cervixes and who need to be on complete bed rest because even getting up to use the restroom, they can put them at risk for delivering, which is crazy. Um, and also, so this is interesting, but then this year, now our unit is actually getting COVID positive patients too. So it's been a wild ride as being a new nurse because this is my first year of nursing, and now I have to learn a whole new disease process, which everybody's trying to learn as well. So for the beginning of this year, so we're still having COVID cases and it's still a learning process, but now we're taking care of COVID patients too with pregnancy. So it's been a crazy ride for all of us.
Yeah, I can only imagine what kind of transition that was, going from nursing school immediately
Mhm.
into the field and in the middle of a pandemic and figuring it out along with everyone else and navigating your
Yes,
career.
yes. That was definitely it was a rough ride because not only was I getting my confidence as a new nurse, but now I have to learn, a whole new disease with the pandemic.
Yeah, so how does that all affect like your unit?
So we don't see a lot of cases. I would say at most we see about 2, 3 cases, during our shift. But it's definitely been hard because we have to keep those patients on a separate unit away from our regular patients, and those nurses have to be either 1-on-1 or 2-on-1. So basically, what that means is that nurse can only have up to 2 COVID patients at a time. And she can only focus on those 2 patients. She can't see other regular antepartum patients because that would be considered cross-contamination. So it's definitely had an effect on our staffing because it really brings down our staffing with the nurses on the floor.
I was just curious, how would you describe the interactions that go on within your hospital that you're aware of between different professions? We talked about at DeBakey, there were a lot of course, there are a lot of different paths you can go down still in the field of medicine, but of course, at a hospital, it's a place of convergence. So, how would you describe these interactions?
So as a nurse, I feel like as a nurse, you are the main person to communicate the needs of the patient between the different fields. So of course, the nurse is the one who, talks to the doctor and communicates any major changes. And then there's other professions that we have like respiratory, there's social worker. There's so many different people that we interact with, but as a nurse, you're basically the person to communicate what needs that patient has with each field in the hospital. I would say.
And in a hospital setting, I mean, I feel like communication is such an important skill to have. So, like between different groups, right? I mean, is the communication like? Do you think it's do you think it could be improved?
As it, like, do you mean like with the field?
Yeah, people have heard of like how doctors sometimes like speak down to nurses, or like different fields don't really think of each other as highly. I mean, do you see that in your everyday work? Like, what is that like?
So me personally, on my floor, I haven't had any bad interactions with doctors. I think it's because we are considered a high risk floor. So a lot of the doctors I work with are they're specialists, so they specialize in high risk pregnancy cases. So me personally, I haven't had any issues with communicating with doctors. Our doctors at our hospital are amazing, and they communicate with us really well because in the end we all have the same goal of helping the patient. So that's why I don't think, you know, we actually work side by side with the doctors, and I haven't had any experience where doctors speak down on me. Of course, I mean, it could happen if like a nurse makes a mistake, but as a new nurse, I don't know everything that comes along with each case. So I always make sure I ask my coworkers, my charge nurse. So I would say as a new profession, I think it's best if you ask questions so that you can prevent yourself from making mistakes because as a medical profession, it can have a detrimental effect on you, on your career, or your patient's life if you make a mistake. So that's why I think I haven't really had any bad experiences with doctors or like doctors talking down to me because it's been really good communication on both sides.
That's really encouraging to hear that uh, of course there are complaints of such interactions happening, but uh, especially I think that's really good advice to ask questions. I know sometimes people are afraid to ask and be perceived as like not knowing the answer, but uh, it's definitely good to. I agree with you. It's good to reach out and understand the situation to avoid making future mistakes.
And I will definitely add to that because in the nursing field, I still meet older nurses who have questions that, they're not familiar with certain situations or certain procedures or medications. So I have even had older nurses ask me for advice on a situation. So, I would say nursing in general is a field, it's a good field if you want to continuously learn and grow because you're going to meet people and you're not going to know everything even as an older nurse. So it's a good career if you want to continue, learning and expanding your knowledge.
I know both Jada and I are interested in is that it's continuous learning. Like there's constantly new
Mhm.
knowledge and new development, and not one person knows everything. So I think that's something really positive about the field.
And especially with COVID, this is completely new for everybody, not for nurses, but including doctors, like respiratory, it's new to everybody. So that's a great example of, how we keep learning in this field.
Yeah, so let's kind of try to shift balance and like all the way from like back in high school, college, nursing school, like up until like your career now. I mean, what's some advice that you'd give to students who are interested in becoming nurses or other medical professionals?
So my biggest advice, especially if you're going into undergrad and you're uncertain of what you want to do, is definitely join extracurricular groups. Kind of dip your toes into different groups to see what you may think that you like. You might not like it. So if you talk to different people and try to, understand different points of views, I think it'll help you if you go to extracurriculars and see what you may think you like or what you may not like. Because I feel like, when I reflect back on my college career, I think my biggest thing was I didn't know what I wanted to do. And I think a lot of students, are kind of unclear what exactly they want to commit to, because I know college can be kind of intimidating. You have to focus on one career that you're stuck with the rest of your life or not. Some people change their minds, midway through their career, but I would definitely say for sure join different groups. And I don't know about now with COVID, but definitely try to talk to different people and see if they have the same interest in, with what you have. And it could spark something that you might want to, delve into.
Joining groups, like you said, and all those extracurriculars, I mean, those should definitely help someone make those decisions. But then deciding kind of exactly what path you want to take, I mean, what did you use to kind of help you? People or experiences? What really helped you make those decisions?
I did have two personal experiences that did really have a big impact on me. My freshman year of college, my stepdad actually was diagnosed with kidney failure. So throughout my whole college career, I would see him struggling with, different medical appointments and, all these doctor visits. And I would see like a lot of nurses, help him out a lot. And I think it kind of opened my eyes to nursing. Actually, we just got recent news that my dad got a kidney transplant. So this past week we've been dealing with his hospitalization. He's actually going to get discharged tomorrow. So that's some big stuff that's happened in our family. But I would say that was a big impact with me choosing nursing. And then also right before I got to nursing school, my grandma passed away from a hemorrhagic stroke. And, before she passed, she was in the ICU. And I still remember the nurse like to this day. And I remember her name of the nurse who took care of my grandma. But she was just so compassionate with everything that we were dealing with. And, we knew that she was going to pass, but it really helped that she was our nurse and she was taking care of not just my grandma, but like our family too. And I think that also really opened my eyes, and it kind of made me want to have that same impact on my patients too. So I would definitely say those two experiences made me want to choose nursing.
Yeah, I know for sure, like my brother was in the hospital for a while, and I mean, the nurses really do make a big difference, like just the patient interaction and talking to the family, helping them understand. I think it was like a really big deal, and it really helps the family.
Yes, of course. And that's what I love about nursing. You get to know so many different people and their families and their, different life paths. So I definitely would think if you want to be a nurse, you have to be a people person for sure.
Yeah. That's really wonderful to hear. And I just wanted to say we've really appreciated your insight and thoughtful advice that you've given us. Thank you so much for the work that you're doing, and we hope that all continues to go as well as possible as you continue your work in the field.
Thank you guys. Good luck with y'all's careers. I mean, are either one of y'all considering nursing or like medical field or like being a doctor or anything like that?
I think we're both considering the medical field.
Mhm.
Um, I can't speak for Jada, but I myself am keeping my options open. Like you had said, decisions can happen at any time, and your influences can shift seemingly overnight. So,
Yeah, I mean, I think the most important thing is just to talk to different people and see what they're doing. Like, I mean, what it's like to have the job that they have and just kind of put yourself in their shoes. I mean, you really don't know what you want to be until you hear what all these different people are doing.
And I would say, I don't know if you guys can do this now because of COVID, but definitely go out and try volunteering in hospitals to see maybe if you can shadow a nurse for a day, shadow a doctor. I definitely feel like that will help you guys too. You can see what the doctor sees and what they go through on a day-to-day basis. So that could be very helpful too.
It was great to finally talk to you, and thank you so much for doing this with us.
thank you so much.
Thank you guys.
Thank you so much for listening to Stories Behind the Scrubs, and thank you to Cathie Lee for joining us for our first episode. If you look forward to hearing our next podcast, click the subscribe button and be sure to follow our social media by going to Instagram and following Stories Behind the Scrubs.